Elaine, I hope I say this right. Vandenburgh, and she is with the Minnesota State Center for HealthForce Excellence, which is an NCHSE member, and she serves as the Healthcare Education and Industry Partnerships Director. So we are very happy to have her, and look forward to hearing what Elaine has to tell us about and talk about with us.
Thank you, Chandra, and thank you, Nancy and Lissa, and thank you to the NCHSE. And thanks to all of you for having me here and for taking time out of your busy afternoons and evenings to talk about this very important topic. As was mentioned, my name is Elaine Vandenburgh. Here's my full title. I'm the Healthcare Education and Industry Partnerships Director for Minnesota State HealthForce Center of Excellence. Blah, that's a mouthful. But in short, I work with healthcare employers. I also work with one of our many colleges and public colleges and universities within Minnesota. A lot of the projects that I work on are pre-nursing, so nursing assistant, medication aid, and what is becoming really popular, mental health first aid. I am also a mental health first aid trainer. I'll talk a little bit more about that in a little bit. I lead classes along with several of my colleagues across Minnesota State. I'm also a coach and a yoga instructor. So I'm excited to be here in this Zoom land, in your Zoom land, wherever you're logging in from today. I'm logging in from Columbia Heights, Minnesota, where it is unseasonably warm. So although I like the warm temperatures to take my dog out, it is a little odd for January, but we'll take what we can get. Here are today's objectives. You probably read these when we signed up. Talk about how mental health impacts, talk about the prevalence and the impact of mental health and substance use challenge. Talk about person first language and how it really reduces stigma. And then we're going to have an activity. So later on, I'm going to be looking for some volunteers, and then information on how your organization can become part of the mental health first aid movement. Here's how we're going to tackle this. I want to get to know you all a little bit more. I also have a little bit more to share about my journey. Provide an overview of mental health first aid. Some of you may have heard about the training. Some of you, it might be new, and that's okay. You're in the right place. We have that activity that I talked about. We are going to share some resources and then talk about takeaways, questions, and next steps. So I think the time will go by pretty fast. I think we're going to have fun. And I love the participation, so please ask your questions in the chat. If I don't get to them right away, we can get to them at the end. A little bit of background about my story. So I work in higher education. I don't work directly with students anymore, although I missed that part. Well, I shouldn't say that. My full-time job, I don't work directly with students. I do teach an online yoga class. You know how college students have to get their FIAD credits. So I teach an online yoga class for college students. But back in 2018, I took mental health first aid training. And within a matter of 2 months, I responded to 3 mental health crises on my campus. And up until that point, I maybe only responded to 3 total with my 10 years of higher education experience. So I thought to myself, is this just a coincidence that I took this training? Or did this training give me the tools to be able to see some of the red flags that I maybe didn't see before? And did this training give me the tools to be able to reach out and offer my mental health first aid skills if people were open to it? What do you all think? Was that a coincidence? Probably not. Probably not, right? The other thing that I think is interesting is just show of hands, whether you want to put in the chat or whether you want to use your emotions or not your emotions, what are they called? Your reactions button. How many people have their CPR certification or have had it at some point in their career? Seeing lots of thumbs up. Thank you. I could see Catherine has a thumbs up. Emily, you too? Yep. Okay, cool. Some people in the chat. So I would say most, if not most of the people on this call, and maybe I missed some folks, most people do especially if you're talking to healthcare educators. Most people in healthcare do say yes to that question. But here's the next question that I have for you all, is how many people have had training on how to recognize and respond to early signs and symptoms, worsening signs and symptoms, and mental health crises? Have you had training in those areas? Seeing some hands, great. One thing that I'll note too is, especially when I go out into the hospitals and clinics and I ask this question, whether it's administrative staff or someone who's working in direct patient care, a lot of people say, yes, of course we've had CPR. Like, you walked into a clinic, don't you know that? And then, but when I ask the question of, raise your hand if you've had training in mental health crises, and the response is much lower. And the question that I'd like to pose to all of you is, what would our communities, what would our schools look like if the same number of people who raised their hand for having CPR training also raised their hands for having a mental health first aid or something equivalent, something equally as life-saving and probably, and I think more statistically likely to happen in someone's professional career, or someone's going to come across that in their professional career. So as I mentioned, I'm also a yoga instructor. So that was kind of puzzling to me. I've had to take CPR several times, but not once did I take a training on how to respond to when someone had disclosed thoughts of suicide, or when I had a student, for example, who maybe had shared maybe engaging in non-suicidal self-injury. And so what would that, just like take a moment and just say, what would that world look like if mental health first aid was as common as CPR? How would our communities be different? How would we treat each other as colleagues, our neighbors? How would we treat our own mental health? To me, that is the vision that really inspires me to do this work in mental health first aid. So that's just a little bit about me. Once I took the training, they were in 2018. It was I realized such lifelong skills that I took the training again and again and again, and eventually I became a trainer in 2020. And let me tell you that these skills were so great to have when I was teaching online in 2020 for college students, and I would imagine also for high school students. We have since, as Minnesota State colleges and university have trained thousands of people in mental health first aid, including our own students, our faculty, our staff. Our high school partners, not all of our high school partners, but we've trained entire school districts. We've trained for people in senior care and hospital settings. And so I'm excited to play a small role in helping that kind of take off in Minnesota, and also in the healthcare and education spaces. And so I just really want to thank you. This is such an important topic. A quick disclaimer, this session that you're in is an intro session. It's not the official mental health first aid class, which you'll learn about in a little bit. This class is really just a sneak peek. So the slides that you see are not slides from the National Council of Mental Wellbeing, which they own the mental health first aid curriculum. These slides are based on my experience and the experience of my colleagues. So of course, we hope you do take a class, mental health first aid class, whether it's now or in the future. You can take a class online since many of you aren't coming from Minnesota. Our next class is March 26th and 27th. It is cost bearing, but there might be other courses near you. So you can also check on the mental health first aid website for courses near you. So whether it's now or in the future, I hope that you take the opportunity to take a class, or at the very least after today, you'll know a little bit more about it and what it has to offer. I want to introduce this space. The space is going to be recorded, so thank you if you're watching this afterwards. We do something in mental health first aid called Challenge by Choice. So I'm going to invite you to participate in the discussion and the activities that we're going to do today, but you always have the choice to practice self-care. What we learn in mental health first aid is mental health challenges are common. And so if something that we talk about today or in a mental health first aid class is particularly fresh or tender, you're encouraged to practice self-care. And you'll notice that in my introduction, I did not say that I am a psychologist or a licensed social worker. One of the beautiful things about mental health first aid is you do not need to be a mental health professional in order to be able to reach out and provide assistance. And so, you know, you all are bringing your great experience to the table, to this discussion that we're having today. And we're here together exploring as a group. I always learn something from the groups that I work with. So I invite you to unmute yourself when you want to ask a question or put something in the chat. I'm a pretty informal presenter. And, you know, if you got a burning question, I'd rather have us talk about that. And you know, feel free to ask those. It's you know, a smaller group compared to, you know, a group of 100. So I see us just exploring this topic together as a group. One thing that I'd like you to reflect or add to the chat is in mental health first aid, I like to say we wear many different hats where mental health first aid might be applicable. So for me, I wear my yoga instructor hat, I wear my work hat, I wear my neighbor hat. You might have a parent hat, you might have a friend hat who has a lived experience with a mental health or substance use challenge. You might have a teacher hat, maybe a coach hat, different hats that you might wear, a parent or a son or daughter hat that you wear. So if you could just for a moment reflect, and then when you have that reflection, write what kinds of roles or hats that you play where mental health first aid might be helpful. Maybe you're a leader in your faith community. Yep, good. Yep, perfect, Catherine. Yeah. Parent and EMS, I see in the chat. Teacher, coach, grandparent, good. Mother, teacher. We have lots of grandparents that take our training. Oh, host a club sponsor, educator, mother, teacher, fantastic. Yeah, colleague. Yeah, I should mention that the school district that we trained with, where we trained everyone within their school district, I think all the, you know, admin staff, people who were teachers, supervisors, colleague was one of those very important roles where mental health first aid was applicable to support each other, right? Siblings. Yeah, great. Thank you for sharing that. The other thing that I thought would be helpful for me to know is what do you know about mental health first aid training already? But since we have about 30 of us, sometimes I like to write a little. You can see this. Sometimes I blur. It blurs it out. And I used to be able to see myself. There we go. Oh, I don't think you can see this, but on one, it's a T. There's a T here. On one side it says no, and on the other side it says want to know. So I just draw a T, and then one side write no, the other side write what want to know. So I'm gonna invite you to take a minute and just brainstorm things that you already know about mental health first aid training and things that you want to know about mental health first aid training. You can use the T chart, you could jot down notes. I'm gonna have you hold off on putting things in the chat just for a moment, just so that we have some time for brainstorming and reflection. And I'm gonna start my timer. So that's why I'm pulling out my phone. So about, let's just say a minute-ish to brainstorm. All right. So go ahead and start to wrap up your thoughts. You can continue this as we go along. But I'm curious what people already know about mental health first aid. You can unmute yourself or you could put it in the chat. What do you already know about mental health first aid? And it's okay if the answer is nothing. That's why you're here, right?
I feel like I have the preconceived notion that mental health first aid is all about de-escalation and crisis intervention, almost a reactive aspect. What I'd really like to know about it is, how do you prevent a situation from escalating, or how do you prevent or ward off a crisis? So more
Yeah.
proactive versus a reactive approach to mental health crises.
Thank you, David. I made note of that. We'll cover that. Good. Let's see here. There's a couple people who have hands up. Wendy or Lisa, I don't know who was first.
Lisa, you want to unmute yourself, or were you just, we see you and Wendy have your hand up. Okay. Go ahead. Oh,
Oh, Elisa says self-awareness when I need some first aid, not much. Okay, so sounds like some people know about the training to ask directed questions. Good.
there's some
Yeah.
other things in the chat too. Someone completed the training a few years back, Emily.
Great.
Yeah.
Yep.
and
Okay.
so there's some information there.
Yeah.
Oh, they didn't know their hand was up.
Oh, that's okay. I think Nancy, you as the host can lower them. I tried to, but I think I'm don't have that desk, or
Not
people
that
can do that themselves.
powerful. Okay.
Thank you. Thank you. And what do you want to know about mental health first aid? So sounds like some people have taken the training. Some people are pretty new, kind of in between. What do you want to know? What do you really hope? Like, if Elaine doesn't cover this today, I'm going to consider this a waste of my time. So David shared a little bit about what he was hoping to learn more about.
I know for me, one thing, I'm already a first responder at the school along with my coworker that's a nurse, and she often pulls that line of, I don't want to help because I don't know where to stop that nursing. How do we talk with our coworkers about getting this more of a positive side that we need this? I know I have issues with guidance counselors saying this isn't my job. So how can we promote this a little bit better within our own region?
Yeah, thank you. I'm taking notes if you see the top of my head. That's why. Good. Thanks, Catherine. When to utilize emergency services when someone is in crisis, best way to handle situations, preventions, it's good in warning signs. Yeah, how can you help someone without? I see a lot of questions about where are the boundaries of my role and where did someone else's role starts? How far do I get involved? I can imagine that is a reoccurring theme, particularly for educators and teachers of K-12, high school, or even, college or adult learners as well. Good. Great. Well, feel free to keep putting stuff in the chat, and we'll boogie a little bit. So I always like to start out with, what is mental health? And in mental health first aid, we always talk about how mental health and physical health are both health, right? And just like your physical health, so we're going to use this parallel because we are used to talking about our physical health, right, a lot. But this is not something we're used to talking about our mental health as much. And so I like to describe it as a continuum that ranges from poor mental health to optimal. And that could change based on the day, the season of life, different things. And where I define, or where one might define where they're on that continuum, is their mental function. Can they concentrate? Can they be productive at school or work? Are they able to have fulfilling relationships? And can they adapt to the daily stressors of life? And so just like physical health, mental health can change, right? And also just like physical health, you can get better from mental health challenges and feeling like you're on one end of the continuum. In mental health first language, one of the things that we talk about is person first language. Unfortunately, there's a lot of stigma surrounding mental health challenges and reaching out for help. And one of the reasons why people don't reach out for help is because there's a lot of stigma still around reaching out for help and having a mental health challenge. But the more we reduce the stigma, the less stigma that there is, the more likely that people are to reach out and get the help that they deserve. And to David's point earlier, this part, reducing that stigma, can really help kind of a community. When I see a community take mental health first aid, I see less kind of early intervention and less, I'm sorry, I should say more early intervention and less crisis situations. It takes practice and it takes time to get there. But mental health first aid creates a kind of a baseline mental health literacy, which the community can start from in terms of their conversations. And person-first language is a big part of that. So this is language that honors a person's individuality and humanity. It recognizes that someone is not their diagnosis, but rather a part of them. So examples of person-first language is replacing the words on the left-hand side of both of the boxes with the things on the right-hand side. So instead of saying someone's an alcoholic, talk about it as the diagnosis that it is, the person with substance use disorder, reducing some of that stigma. Instead of someone calling someone an addict, a person who's in recovery, you know, not labeling someone and really using this person-first language. This is a big key to what we talk about as mental health first aiders. We also learned that mental health challenges are common. If you can't read the screen, it says 1 in 5 U.S. adults experience mental illness each year. Does that seem high or low to you? What do you think? Let me know in the chat. Or does that seem about right? Seems high, seems low. Yeah, it's tricky, right? Because this statistic was actually taken right before the pandemic. And so a lot of times people say this number seems a little bit low. But I think it just kind of depends. I mean, the good news is not the good news, but the interesting, I think, part about this is the next statistic that I'll show you on the next slide. So this says 1 in 5 U.S. adults experience a mental illness each year. This next slide says in the United States, almost half of adults will experience a mental illness during their lifetime. So we even learn it's even more common. And what we learn from these two statistics juxtaposed together is that recovery is possible. So recovery from a mental health illness, just like a recovery from a physical illness, is possible. And evidence of that is these two juxtaposed together, but also in the fact that mental health first aid is rooted in evidence. So it kind of reduces some of the stigma when we know about those things, and it shows that recovery is possible. That's a big value that we as mental health first aiders can instill in the people in our communities and in the work that we do. Here's another interesting statistic. This is probably not surprising, but a majority, 68%, worry that reaching out about a mental health issue could negatively impact their job security. So this tells me that workplaces are a pretty good reflection of maybe other communities or sub-communities within a larger community. And so this tells me that we got a lot of work to do as colleagues, we got a lot of work to do as supervisors, as leaders, as coaches, to really reduce the stigma. This particular part is about job security, but this still shows that the stigma is there. Depression and anxiety disorders cost the global economy 1 trillion lost productivity each year. Not only is there a moral sense, but there is a business sense to pay attention to the mental health needs of the population that you're working with. And so I like to make this point because if you're looking for a grant to help fund mental health first aid training, there are different statistics out there that are specific to teens, specific to maybe teens in your geographic area. You know, it might be helpful to talk about that, and then also talk about the business case for investing in the training, in addition to the moral case. Like, I would argue there's a moral obligation here, but people can might also be more likely to support the financial investment if they see that there's a business obligation. So knowing all this, how do we really understand and respond to signs of addictions and mental illnesses? And that's really where mental health first aid comes into play. So mental health first aid is like a CPR class. It's essentially the initial help offered to a person developing a mental health or substance use challenge, or someone who's experiencing a crisis. So just like CPR, the first aid is given until appropriate treatment and support are received, or until the crisis resolves. I would also like to mention that mental health first aid is evidence-based. And so it's an evidence-based training, similar to CPR, where you get a certificate at the end. It has a very defined scope. Someone had mentioned in the chat if Good Samaritan law is covered. And I think most state people are covered under the Good Samaritan law, using their mental health first aid skills, but check specifically in your state. I know in Minnesota we're good. And I think that's true for many states, but I guess it's been a while since I've checked that. So I would recommend checking that. Here's what participants learn in the training. Risk factors and warning signs. Some people mentioned in the chat that's something you'd really hope to learn more about. Information on some of the most common mental health challenges, such as depression, anxiety, psychosis, substance use, and trauma. My favorite part of this training is something called the 5-step action plan. And this is an action plan that you can use whether you notice early signs and symptoms, like early signs and symptoms, worsening signs and symptoms, or crisis situations. So also early intervention. And then we also talk about self-help resources, because as a mental health first aiders, we have to practice that self-care as well. And it's also nice that it's evidence-based. So knowing that we're joining here the education industry and the healthcare industry, both of those industries really rely on evidence-based practices, and you can be rest assured that mental health first aid is rooted in evidence. Here is the LG action plan. LG stands for ALGEE. And if you're wondering why there's a koala on the slide in sunglasses, it's because mental health first aid was developed in Australia. Yep, it was developed in Australia in 2000 by a couple who kind of had a similar vision. Hey, why isn't there something equivalent to CPR for mental health? Especially considering the prevalence rates for mental health crises. And so here is the LG action step. So A stands for assess for risk of suicide or harm. L is listen non-judgmentally. I'm only reading these not to be a jerk, but I know that some people are mainly listening today and can't see the screen. So G, give reassurance and information. E, encourage appropriate professional help. And the second E is encourage self-help and support strategies. I will note here, it is really great that you, as a mental health first aider, you do not need to use all of the steps in the LG action plan. 9 times out of 10, when I use my mental health first aid skills now, all someone needs is a true listening, non-judgmental ear. And we talk about how that kind of listening is different than maybe our everyday listening. Or maybe they just need some encouragement to practice self-help, right? So you don't necessarily need to use all the steps in the LG action plan, nor do you need to use need to use them in order. And that's what I really like about this. To the question that was earlier is, interestingly enough, mental health first aid is actually most effective as an early intervention strategy. So when communities invest in this training that gives people the baseline mental health literacy skills, it equips them with the LG action steps. It really talks about how mental health first aid is most effective as early intervention. Of course, it can help with crisis and has evidence in helping with crisis situations. But here's the thing that I think is important to share. People are more likely to reach out for help if someone close to them suggests it. So they're more likely to, people are more likely to reach out for help if someone close to them suggests it. And the more people that we have trained in mental health first aid who know what the help looks like and how to encourage appropriate professional help, or the second E, which is encourage self-help strategies, the sooner that we can do that, the kind of this part on the continuum, or on the more well side of the continuum that our communities can be, and the more resilient that they'll be over time. When I meet with leaders of hospitals and clinics across Minnesota, a lot of them are telling me, and even in high schools and in even colleges, schools and colleges, one of the number one challenges is retention and engagement. People are feeling burnt out, not all everywhere, but they're just noticing that more. And so this, to me, is one of the single best ways that organizations can tackle burnout and increase resiliency skills. Here's what some of our employees have said about this training. Now, I recognize many of you work with high school students, and these quotes are taken from college instructors or people who work at colleges, but I'll just read a couple here. I feel strongly that this class can save lives. Ooh, that's powerful. I would encourage anyone that works with students to attend this class. Mental health first aid has been instrumental in heightening my knowledge and ability to support students. And this has been one of the most useful and practical trainings I have received at Century College. Wow. To me, as educators, we take a lot of training, don't we? Right? We take a lot of training. And so to say that this is one of the most useful and practical trainings, I think speaks a lot to the evidence-based and also the skills application that we do. We learn about mental health first aid skills, but then we apply them and we role play, we watch videos. Even if you're taking it online, it is a very interactive training. So people are shocked that, oh my gosh, I didn't realize the Zoom training can be so engaging and the time just flew. So this speaks to some of the questions earlier. Mental health first aid does not supersede any professional responsibilities, legal responsibilities, organizational procedures that a mental health first aider may have as a mandatory reporter, a first responder, a clinician, or a government employee. So it's possible that you have some school or some professional responsibilities or procedures that you need to follow. And so this does not supersede any of that. And it also does not teach people how to be therapists or how to diagnose or how to treat mental illnesses. One of the things that I appreciated most using the mental health first aid skills during the pandemic was when I was in the teacher role, is knowing very clearly, and mental health is very good about telling you what is your role and what is not your role as a mental health first aiders. We connect them to the professionals, we use the LG action steps, and we can sleep at night knowing that we've done everything that we can do that's rooted in evidence and empowered the person to take next steps if and when they're ready. And so this to me is something that I think can be really helpful, especially if you're feeling like those boundaries might be blurry, right? When it comes to where does my role end as a this, as a that, in terms of that. When you put on your mental health first aid hat, those lines become very clear. Okay, so now the activity. I'm going to tell you right now, it's gonna be awkward. And I don't know what it's like in your states, but in Minnesota, I grew up in a small Minnesota town. We don't like to feel awkward or uncomfortable very much. We like to fill the silence but this activity is gonna be a little awkward, and that's okay. So I need two brave volunteers who are willing to read a slide with conversation starters. So I'm going to talk about something that I'm a fake scenario about something that I'm struggling with. And then there's going to be 2 rounds. My 2 volunteers are going to read sentence starters, and they're going to finish the sentences in their own words and then respond to me. So 2 volunteers. I'll even show you the slides. So this is called listening round 1. So the first volunteer would need to start sentences with, you should, you need to, I would, have you tried, or keep your head up, or why. May I have 2 volunteers who are willing to unmute themselves?
I could do it.
Thank you, Catherine. Thank you. May I have one more volunteer? Oh, Lisa, I think you're on mute.
Okay. If nobody wants to volunteer, I guess I can.
Okay. All right. Thank you, Lisa. Thank you, Catherine. All right. This might be, I know that educators generally like to help people. So these, I'll tell you right now, this first script might not feel like your own words, but that's okay. Do your best acting. So I'm going to talk about something that I'm struggling with, and Lisa and Catherine are only going to respond with sentences that start with any of these 3 bullet points, 4 bullet points, excuse me. So I'm going to say something, and Lisa's going to say, you should do this. Then I'm going to say something else, and then Catherine's going to say, have you tried this? And then, so do you get the flow?
Sure.
Okay. All right. So Catherine, why don't you start us off by saying, hey, Elaine, how's it going?
Hey, Elaine, how's it going?
Oh, Catherine, I am not getting good sleep. I feel like a zombie.
Well, you should just try to have some chamomile tea and read a boring book before you go to bed. It works for me.
Yeah, I know about chamomile tea and books. Thank you.
You know,
Lisa?
I once tried to have started taking magnesium, and that has really helped. I read about it on TikTok.
Yeah, that hasn't worked for me either.
Well, Elaine, keep your head up. You should be grateful. You may have a hard time sleeping at night, but at least you have a job that you can get up and have a good job to go to in the morning. It could always be worse.
Lisa?
Oh, why do you think you need to have better sleep?
I mean, I can't function. Like, I can't make decisions. I can't concentrate. I just feel like I said, like a zombie. Oh gosh, it's just, I don't know what I'm gonna do.
Look, just get some more sleep and you'll feel better.
And then
Yeah.
one more, Lisa.
I guess it could be worse. You could just never be able to sleep. At least you're able to sleep an hour or two.
And close round one. Thank you. Thank you. Okay.
I don't think we have a career in acting, Kathy.
No, it's good. I forgot to, whoops. I think I touched, okay. I forgot to give you all, the rest of you non-volunteers, an assignment. And your assignment was to write down your observations, but I think you can put them in the chat or unmute yourself. What were your observations when Lisa and Catherine were so kindly acting? What were your observations? Chandra, you unmuted your video, so I'm calling you.
Just watching, they were more, it was more about kind of just speaking comfort rather than looking for more detail or questioning other things. They were more about making suggestions rather than asking questions.
Ooh, yes. And Chandra, what is the sub message inside of making the suggestions?
That to me is okay, I'm sorry about that, but let's move on. It's not important.
Yeah, it's not important. And you can't, I'm making suggestion because you can't figure it out on your own, right? Potentially. Yeah. Or it's not important. Good. Some good stuff in the chat. So it didn't seem like a real issue to them. It was difficult not to give advice. Felt like they were minimizing the struggle. Did not have any real sustainable answers. No one asked what you felt like you needed. Didn't seem a priority. Yeah. Luckily, this is no longer a real struggle for me, but this absolutely was for a long period in the last 5 years. And let me tell you this, people love to give advice about sleep, right? People that I know that I'm a yoga instructor, know that I work in healthcare and education. I know this stuff, right? And so sometimes when people would say, oh, have you tried yoga before bed? I'm like, I'm a yoga instructor, like, come on. And so even my well-intended community and those that love me, I always didn't know what to say. They didn't know what to say, right? I think how many of you are a fixer? How many of you like to fix? Right? Is that what's going on here? Okay, let's look back at that slide for a hot second. Okay, bullet one, you need to, I would. How many of you should on yourselves during the pandemic? Oh, I should be doing something productive. Everyone's doing something productive, but all I'm doing is eating cookie dough and watching Netflix. I should be doing this, right? Or whatever you're doing to cope, right? But we should on each other a lot. We should on ourselves just as much. And so be careful of the shoulds. Use them sparingly, right? if you're wearing a mental health first aid hat, or a hat that wants to convey the open listening, you need to, I would. That's a very judgmental statement, right? It doesn't necessarily mean you can't ever say you need to, I would. It just means when someone's finally opening up about something that they're struggling with, this is maybe a time to take some of those, take off that fixer hat and put on our listening non-judgmental hat. Have you tried this? Have you tried this? I have some friends who have been diagnosed with cancer, and let me tell you, they have told me that everyone loves to give suggestions when it comes to different, cancer treatments or nausea for the chemo or different things like that. So if the purpose of listening when we learn in mental health first aid is to feel seen, heard, and understood, right? And from what I read in the chat, it doesn't sound like a lot of that has happened. You both did a great job of, you should be grateful, at least you have this. It could be worse. Oh my gosh, this is not the sympathy Olympics, right? We're all allowed our space to process things and to have our true experience. And then the whys. Whys aren't always bad, and none of these things are always bad. These are just things that I found when I took the training that I said a lot. Okay, let's try a round 2 here. So same, if you could please be my same volunteers, Catherine and Lissa. And we're going to try the same conversation, but now you can start sentences that say, I see, I hear you, that's understandable, tell me more. Or reflective statements as, I hear you saying this, does that sound? Or asking deeper questions like, how does that make you feel? What have you tried so far? What do you think you're going to do next? So let's take a quick moment to do round 2. And Catherine, start us off by saying, hey, Elaine, how's it going?
Hey, Elaine, how's it going?
Oh, Catherine, I just am not getting any sleep lately. I feel like a zombie.
I hear you. That's understandable. Not getting sleep, you feel like a zombie. Wow.
Thank you. Lissa?
So I hear you saying that you're not getting enough sleep. Is that right?
Yeah.
It sounds like you're frustrated.
Super frustrated. I mean, I can get to sleep, but I can't stay asleep. So that just is really difficult.
What have you tried so far?
Oh, Catherine, good question. I tried chamomile tea. I tried melatonin, magnesium, hot baths. I tried yoga. I tried not eating. I tried giving up caffeine. I feel like I've tried everything that you can think of. Not putting my phone away, reading a boring book, everything.
So how does that make you feel that nothing has been able to work for you?
Oh, gosh, I feel like I don't really know what to do next. Like, I feel kind of alone.
I get that all the time. So it would be hard to come up with what your next plan is going to be I don't think that would be the right thing to say.
No,
Never mind.
No, keep saying it. No, actually, I think I know where you're going, and I think it's an okay thing. The last bullet point.
Yeah, that's what I was thinking. I'm wondering, like, it sounds like you've done a lot of the common things to help with sleep. Do you have a plan for what you could do next?
Thank you. I think I'm going to talk to my doctor because I feel like I've tried everything that I can do. So I feel like maybe it's a medical thing, right? Give me one more and then we'll end.
Well, that sounds like a good plan. I hope that works.
Thank you. And end.
Yay.
Yay! Well, I bet that felt a lot more natural for you both. One of the things I want to mention here is how much more information did you get out of me? That was about the same time, by the way, for the conversation. How much more information did Lissa and Catherine get out of me? Round 2. They learned about way more things that I tried on my own. They uncovered a lot more deep feelings, right? if you think about airtime, I had a little bit more airtime than they did, which is okay in these kinds of conversations. So when I first took, actually, let's break down these real quick. So when we take mental health first aid, you really learn about listening and listening in a non-judgmental space. And so what I've learned is I've learned to take these statements and replace them with some more of these when I'm putting on my listening non-judgmental hat, which is applicable in many situations. Asking the deeper questions. Another question that I love is, how long have you been struggling with sleep? Or how long, like some sort of how long question to really kind of help people kind of assess, like, is this just like a 2-day thing, or is this like a 3-year thing? Because that is going to determine, the rest of your LG action steps that you take as a mental health first aider. What have you tried so far? This is such an empowering question. And I just want to point out, like, from an audience perspective, didn't that feel differently? And also for you, Catherine and Lissa, didn't that feel viscerally different? Right? You probably are feeling more comfortable with the second interaction, perhaps, than the first. So all this to say is that as a mental health first aider, you get an opportunity to practice these skills that you learn. And this is just one part of one of the LG action steps that you learn, which is listening non-judgmentally. So before I took the training in mental health first aid, I thought my listening skills were at like a 7, 8, 8.5, maybe, right, if I might have a good day. Oh boy, I took that training and I realized really quick, like, I am not a great listener. I am surprised my friends and family still open up to me because I want to fix and I want to give advice. So I learned through this training that not everybody likes unsolicited advice, and it's not always helpful, right? And so I think that can be a really helpful tool. So we have 3 minutes left. I want to be respectful of your time. I'll stick around if people have observations or questions that you want to talk through, but I invite you to just kind of keep your own observations and noodle on that if it makes sense. I do want to mention some resources. You've heard about 911. I'm sure you have, right? What to do in case of a medical emergency. Do you all know about 988? Okay, so some yes, some not sure. 988 is the National Suicide Prevention and Crisis Lifeline. It could be text, you could call, you could text, or there's also an online chat that you can check out. This is administered slightly different in every state, but it is available on the national level. Also, a couple other national resources. The Steve Fund is a really great resource for community specific for young people of color. And then the Trevor Project is to support LGBTQIA+ individuals. So you might all have different resources that you use. And as a mental health first aider, you learn about the national resources and then get an opportunity to curate or, kind of pull together the resources that you have available in your specific communities. Just out of curiosity, what resources do you all use as educators currently in terms of, sounds like counselors, I heard that in the chat earlier. There's other great resources. Please put them in the chat and then we can share out when I send out that email that you use, whether it's community specific. Okay, yeah, these are really great ones to start with. Sometimes instead of having someone call 988 directly, I call 988 and say, gosh, I'm in this sticky situation. I don't know how to approach it. I want a second opinion. So you can also call 988 if you're not sure what to do. So we kind of talked about other resources. I will end the slides, but I will stay on for questions. So this is, if you're wondering, this is my puppy. If you're wondering who he looks like, he does look like Oscar the Grouch when he doesn't have a haircut. But I will stay on for questions if people have questions. Here are the 3 key takeaways that I hope you're taking away from today. This is such an important topic, so I want to thank you again from the bottom of my heart for taking time out of your busy schedules to pay attention to this, to learn more about it, to have discussions about it, right? There's so much more to learn about mental health and challenges. This is just surface. Mental health first aid provides a really great foundational level to build from and to grow. And I hope that you sign up for a class, whether it's now or in the future. Here's the class that we have coming up. I'll send this out in the email. There's also many other classes that are happening around the country. This is a virtual option. But you know, take it through us, take it through mental health first aid. I just think it's a great training. Here are my sources used. And then I just wanted to thank you. So I will stop sharing. And then I don't know, Nancy and Condra and Liz, if you want to allow time for questions, I'm happy to stay on, but we are 1 minute to 4 or 5 if you're in Eastern time.
Yes, thank you so much, Elaine. You have really gave some amazing information and resources and some eye-opening statistics, for sure. Yes, any questions, please put them in the chat. I do want to invite you guys back next week. The 7th, February 7th is our next Wednesday webinar. And that will be to discuss farm tech education. So please join us then. Is there any questions? Lisa, anything you would like to close with? Kathy, do you have anything you would like to share?
No, thank you, Elaine.
You are
Yes,
welcome.
Thank you so much,
Yes,
Elaine.
that was awesome. Thank you.
Thank
Thank you. Thank you.
I have one person who asked for the link in the chat. Oh my gosh, and someone asked the question that I am so embarrassed that I did not cover. Okay, so here is the key question is this a good class to take for youth? Okay, so there are 3 kinds of mental health first aid. There's adult, there's youth, and there's teen. Adult is training for adults who are looking to use their mental health first aid skills to help and support other adults. There's youth, which is training for adults who are looking to support and use their skills for youth, so 16 to 24-ish. And then there's teen. Teen is a peer-to-peer option, but teen is only available directly through mental health first aid, and teen can only be implemented into high schools if at least 10% of that community is certified in youth or adult mental health first aid first. So they don't want mental health first aid, I'm assuming did this because it's based in evidence, but schools that are doing teens mental health first aid have at least 10% or more of the staff or teachers that are trained in adult or youth mental health first aid before going into that. I also want to mention, and I'm sad I didn't put this on my slide, but I'll send it out afterwards. NAMI, your state's NAMI chapter, is a really great resource on where to go to for some high school options. Our NAMI here has a really good video that they come play at high schools and facilitate a conversation, I believe. And we get questions asked all the time. Can we teach this to high school students? And because of psychological safety and how the brain grows and develops, you do need to be at least 18 to take this training, unless your organization's eligible for teen, which I mentioned before. And I'm sorry I didn't put that in there. I completely forgot. So thank you. Awesome. Good. Thank you, Lisa, for having NAMI come as a guest speaker to your class. And thank you. Other questions, friends?
All right.
In the chat, thank you.
Yes, and Karen, she posted a reminder in the chat, you guys. The certificate for participation will be emailed out in about 2 weeks. So just a reminder.
I hope you all can practice some self-care today.
Okay, well, thank you.
I almost called today. I said Thursday today. I was like, today is Wednesday all day. Have a great rest of your Wednesday.
All right, let's go get some good sleep.
Yes, yeah. I know, right? Thanks to my wonderful volunteers. I really appreciate it.
All right, thank you very much.
Yes, thank
Bye,
you.
everybody.